Okay, next I'm going to ask Commissioner Dixon to come up and give us an update on how things are going from the county perspective in terms of their involvement within IHN CCO. So Commissioner Dixon is a board member of the IHN CCO board, and then of course the Benton County Commissioner.
Thank you, Kelly. Well, speaking on behalf of Benton County, we're delighted with the partnership that we're engaged in with Samaritan Health and Lynn and Lincoln counties and the CCO and the CCO board of directors, and we're delighted to be represented on that board. Now, we do these things every once in a while, I think once a year in each county, and when I realize that I'm supposed to say something, I email Kelly and say, what would you like me to talk about? And this time she said she'd like my view of what are the three most important responsibilities of the board of IHN CCO. And that wasn't difficult to come up with. I think that's assuring better community health, better individual health, and doing it at lower costs. And Kelly talked about lowering the costs. Better community health starts by educating the number of people who receive education about health or who don't receive education about health so that they're more knowledgeable about it. It's also I can't read my notes. It's my writing, so it's my fault. The individual situation is to provide care, preventive and remedial to more of our population. And we get to the lower cost by changing the way that we pay for health care. Others can talk more about that, but we cannot revolutionize health care by continuing to provide it in the same way that we've always provided it at the same expense. Doing more of the same will not produce different results. One of the other things that Kelly asked me to talk about was what's the most exciting thing the board of directors is involved in today. Well, I think many of you probably are closer to the excitement than I am on a regular basis. The board meetings aren't typically something that you would consider to be exciting, but they're productive and important. But we do exciting things, and one of the things that I'm excited about is the Health Navigator program between Corvallis 509J, financed by IHN CCO, and performed by our health department. There are 3 bilingual navigators who are working with the schools to bring health education and care to students and families who have not previously had those resources. So I hope to see that program continue. I think it's about at the end of its initial life. I'd like to see it gain more life and be expanded in other schools as well. So that is something to get excited about. So Kelly, thank you.